Good day, everyone. My name is DAKKSHAN. I'm from group number 25, and today I'm going to demonstrate to you the emotional care for terminally ill patients. Now, first of all, let me explain to you what a terminally ill patient is. So, of course, as we know, when we put the two terms together, terminally and ill, it means that the patient is practically waiting to die, right? So, the patient will have all sorts of emotions: anger, denial, uh, acceptance, all those kind of stuff. They will have it in their head during this period when they are terminally ill. And of course, once they are made aware of it. So, what can we do as a nursing assistant? As a nursing assistant, we should always be present for this patient when he or she needs us. And we should always be consistent in our responses to the patient, and it should be guided by the patient's attitude and the care plan of the patient. We must always be open, receptive, and receptive towards the patient. And also, you can maybe be understanding and empathetic towards the patient. And it's also important to note that you always have to give your best and most careful nursing care with this patient, okay? I understand that I shouldn't be too upbeat about this video as it relates to death, which is not a happy thing. But I have a few video demonstrations for you as to maybe give you an idea of like how you should emotionally care for a patient that is terminally ill. So, for the emotional care that a nursing assistant can provide to a patient that is terminally ill, is we can do things such as be present for the patient when he needs someone to talk to, or maybe you can listen to the patient, you can encourage the patient, you can comfort the patient. Those are the things that you can do verbally. So, for instance, I'm going to demonstrate to you right now. So, like right now, Mr. Panda here is terminally ill. So, let's see how this conversation goes. Sir, I feel so sad. I don't want to leave my family behind. Why is this happening to me, sir? Well, sir, let me reassure you something, okay, sir? None of this is your fault. None of it is your fault at all. You've done everything that you could, sir. And you have proved to us what a strong man you are, sir. And we are all so proud of you for fighting, sir. But why, sir? Why is this happening to me? Sir, I know you're a religious man, and what I can tell you is that God always has a plan for all of us, and your family can't see you suffer anymore. It hurts them just as much as it hurts you, sir. I understand that the pain is unthinkable, but they are hurting so much. They are suffering too, sir. And maybe if we let this go, sir, maybe they won't suffer as much anymore, and maybe they can start opening doors to newer things or to bigger things in life, sir. Maybe it's best, sir. All right, sir. Okay, sir, come on here. Let me give you a hug. Okay? It's okay, sir. Things are gonna be okay, sir. Don't worry, okay? Another thing that you can do to provide the patient with emotional care is maybe you can divert his attention. Maybe he's been thinking too much about what is going to happen and what could happen, although he knows the end result, but he's thinking about things that could happen to his family and so on. So the things you can do to divert the patient is you can allow the patient to maybe read a book or listen to some music. As you can see here, I'll be giving this book to him. Okay, sir, this book I found here, I thought it's something that you might like, maybe just to pass your time. Okay, maybe it can divert your attention a little bit. So if you'd like to read it, here you are, sir. Thank you so much, sir. I'll read it, sir.